Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's understand the Cauda medullaris syndrome. The Conus medullaris syndrome versus that of the Cauda equina syndrome. So this is the topic of discussion. So first let's completely look at the CMS and then we move on to the CES. Cauda medullaris syndrome, Conus medullaris syndrome. So here the injury lies in the vertebral column injuries. It's the vertebral column and it lies between the T12 and L2. So this is between the T12 and the L2. Next will be the PS. PS means the pathophysiology. Pathophysiology wise, it is on the upper and the lower motor neuron involvement. So upper and the lower motor neuron involvement. Next is the motor strength. It is symmetrical motor impairment. The symmetrical motor impairment. And reflexes is the knee jerk is preserved whereas ankle jerk is affected. So ankle jerk is affected. Under the sphincter dysfunction, there is urinary retention. So sphincter dysfunction. Under that, there is urinary retention and presence in early in disease course and presence early in the disease course. There is absence of the bulbocavernal reflex as well as there is radicular pain and low back pain. Low back pain. Next is Cauda equina syndrome. It is nothing but the CES Cauda equina syndrome. The injury is nothing but the vertebral column. The vertebral column, the injuries are distal to L2. Injuries are distal to L2. And the pathophysiology is the lower motor neuron involvement. Lower motor neuron which is involvement. Now let's look at the motor strength. Motor strength is there is asymmetrical motor impairment. Asymmetrical motor impairment which is seen. And reflex wise, the CES, that is a Cauda equina syndrome. Both the ankle, the reflexes, both the knee and the ankle are affected. Next is the sphincter dysfunction. There is again urinary retention here as well and it presents late in the disease course. Whereas in case of the Conus medullaris syndrome, it was early, here it is late. And then the similar functions, that is there is absence of the bulbocavernous reflex as well as the radicular pain with the lower back pain as well. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.